I'm one of the new GP registrars at Oka Jameson in Wannable. I grew up in Egypt in a town in the south near the River Nile. I did my school and my university, and then I did a year of internship and some GP practice as a GP registrar. Then I decided to move to Australia. I looked at other countries, specialist countries near Egypt, but then because I was interested in GP practice, so when I looked at the GP training in Australia, I found that it was really good. I looked from other perspectives, like first the lifestyle, and I felt the lifestyle for GPs in Australia really was suitable for me. The other thing is the quality of training that I will get here will be much better. It's not easy in other countries to get such a specialized training in certain areas, like as it happened here in Australia. Like if you are in GP, it's not easy to get a training in pediatric or ONG. It's easier to do it here in Australia. My husband is a pharmacist and he did his exams and he got a job offer here. He came on a permanent resident visa and I came as a partner. There was a language barrier for me, and once I was able to get better in my language, that I felt everything became easier. When we first came, we didn't want to live in big cities, and we found everything in Wannable. Like, we immediately fall in love in Wannable. Once I passed my exams, I started applying for jobs, and I got a job here in the hospital in Wannable. I did 1 year as a pediatric registrar, so that's one of the good things about coming to Australia. Like, I was in the GP program and they allowed me to do advanced skill in peds. I was also interested in ONG, so I did 18 months as an ONG registrar. After that, I started looking at clinics, and I came here to Oka, and I found the other GPs here. I could learn a lot from them. I called one of my friends who spent 2 years here, and she's going to renew her contract to stay here, and she had good experience with them. So actually, I felt better about the decision to come here. I started to have an area of interest in dermatology, and some of the GPs here manage all the skin cancers, and I learn a lot from them. And I still do, to keep my skills in ONG and PEDS, I still do 1 day in the hospital every week. I feel well supported all the time. I ask questions all the time. I interrupt my supervisor all the time. They never get upset. I also get time for teaching, and also time to sit down with them, observe them, and learn from them, especially like the procedure aspect. I'm practicing the way I want to practice. So yeah, I'm having a really good time here. So the reason I became a GP is that a GP can manage the whole patient problems, not a certain problem. I remember when I was in hospital doing some ONG training, if a pregnant woman come and complain of a rash, it's just they send her away. While as a GP, you can manage the whole medical condition. And also, the most important thing is that you maintain a relationship with the patient. You can have a patient who's lifelong relationships that you treat them. I think the training program for GPs in Australia is amazing. And yeah, I would advise anyone to come here.